So I hired this client about a month ago. So I knocked at the door. He opened the door, and really, the poor guy was sleeping on the floor. No mattress in the winter, middle of February. No mattress, no blanket, nothing. And when I got there, he was so surprised and at the same time excited to see me because he knew that I was there like to help him, right? And the first thing he told me was, please, I need your help. Help me. No mattress, no chair, nothing. And I did everything like to get him. I contacted the furniture bank to get him all like a bed, mattress, everything. Me, when they set up the visit to go pick up his furniture, I had to contact him and tell him, okay, they set up the date for this date, so you have to go at this time. He didn't want to go alone, so I had to like walk after hours. But at the end, see him smiling and saying thank you over and over. It was just good to see. The big part of my job is advocating for clients to make sure that they have support and access to the resources in the community. They know like where to go to find um, support. So I advocate for them, and I'm kind of like a bridge between them and those like agencies in the community, like resources. My clients are home community and home-based clients. They are seniors. They are homeless. They are people dealing with mental health issues, all kind of mental health you can imagine. So how it works depends because Carefor um, works with like it's in partnership with different organizations. So they worked with Ontario at Home, Hospital Kingsway, Morford, and Briere. So depends if the client is from the referral comes from Ontario at Home or one of at home program. If, for example, the referral comes from Ontario at Home, we have how it works. We have like 4 visits. It's like short. It's not permanent program. It's short-term program. 4 sections, and in those 4 sections, with the client, we'll sit. We will have like what we call initial visit, where we're going to sit with the client, set up goals we're going to work on together, and then based on those goals, we're gonna kind of put kind of timeline, if I can call it like that. But we can always like extend, depends on how the process goes and how we work with the client, right? There's always like a flexibility to work around. We don't just like you provide the client resources and then like go do you know. We do like to support them to the end. I do because at the end, when I'm about like to discharge a client and we reach out the goals and when they tell me thank you for your help, thank you so much, it just warmed up my heart.